Hello everybody.
How you doing today?
Merry Christmas, Happy Holidays,
Happy New Year.
coming up soon.
Today's today's December 28th.
We are back where the magic started.
2 years ago we did our first video right here in this same little patch of woods. A lot of stuff has changed since then. I think the biggest change that we've had in the 2 years is being able to meet so many wonderful people and being able to travel around and see different things and bring you guys along with us.
This year especially, we were able to go to meet up in the Mohicans in June.
And then we went to the Mayberry meetup, and we got to meet all kinds of different YouTube channels along the way.
Yes. We got a new dog.
The latest thing that we had is my new hip. 2 weeks ago today, I got home from having my total hip replacement.
He's got a matching set, so that's why we're here. We're here walking around, getting some exercise, and getting ready so we can go out hiking soon.
So just walked a half mile today, and hopefully we can build it up by the end of next week. Maybe we'll get to a mile by the end of next week. We'll see how that goes.
So this video is a little bit about his hip replacement, going through some of the stuff we went through, going through some of the stuff that we have now to help him. Hopefully this will help somebody. A couple of the items that you can actually use for camping. So that's what we're doing.
And
somebody's getting whiny.
somebody wants to keep walking. She's my motivator. She's like, keep walking, Daddy. You're not walking fast enough. Good morning, everybody. Well, today's the day.
We are headed to Buffalo to the VA hospital, and I hear they're giving out hips today.
Well, I'd like to start out by saying that I'm very appreciative of the VA for everything that they did and the care that they gave me and everything that the doctors, the surgeons, everybody down to the nurses and the nurses' assistants, everybody did everything really nice and were very nice to me. I went into the hospital a little apprehensive, not knowing exactly what was going to happen, what was going to, I'd been through it before with my other hip, but it was with a different doctor, different hospital, different type of thing. But the professionalism was outstanding. Bella's always got to try to get into this shot. I got to the hospital early in the morning to check in, and they rushed me right away. It was kind of strange. It was kind of right away we got rushed away from each other, so it wasn't like we were kind of concerned that I wasn't going to be able to see her before I went into surgery, but Judy was in the waiting room right away quick, and then they brought her in just before I went to surgery. Got into surgery, and one of the doctors came in and said, we have some bad news. We're going to have to delay the surgery for a while. It's 11 o'clock right now. My surgery was supposed to be at 10:30. They had I don't know how to describe it, but they had
Something happened with the room, and they have to
re-sterilize the room. So it's going to be 2 more hours. They said probably around 1 o'clock before the surgery. Headed back down again, and when I came back to, I was upstairs. It was 4 o'clock in the afternoon, and everything was all over and done with. Well, that went as well as can be expected. Took a little bit longer than I thought it was going to.
Waiting on your pain meds?
Waiting on some pain meds. And the next morning I got up, and the nurse came in and did everything that they were supposed to be doing to get me ready to get up out of bed. The physical therapist came in, occupational therapist and physical therapist, and they did a bunch of different exercises with me. I got up and started walking up and down the hallway. They were very impressed with how well I was doing right away quick. And then the surgeon and the doctors came in and they were very impressed at how well I recovered from the surgery already. And they've signed my release papers, and I was able to leave at 10 o'clock the next morning. So for a full entire hip replacement, I was able to leave less than 24 hours from when I had the surgery, which still amazes me. And now we're about 2 weeks working on our third week after surgery, and I'm out walking and doing what I can, trying to build my way up to being able to do hikes and be back to doing normal things again. Okay, I just want to be upfront with everybody about things that, I may be able to have come home, less than 24 hours from when I had the surgery. But I was still dealing with a lot of pain, and the way to describe the pain, I guess, is that I was in a lot of pain before I had the surgery from my hip being so bad. But when I had the surgery, that pain was gone, and I had a different pain. And the pain was probably a little bit more intense than the pain that I had in my hip to begin with. And that can be scary, but it slowly goes away. When I first came out, they gave me different pain medicines and that type of thing to try to control the pain, Tylenol and some oxycodone and that type of stuff. I did well. I'm not really a pain medicine type of person. I've never really liked that type of stuff, but it does help an awful lot. And the way I can tell you is that the pain may be intense when you first get done with the surgery, but the way I think about it is that I can honestly say that the pain is going to get better every day. And it's a way to look at it that way. That before it was a constant pain, even though the pain was worse, it's going to get better. That's the way I looked at it, and it's gotten better to the point where now I can get up and walk around, where when I first got home, I needed Judy's help to get in and out of bed and that type of thing. But things have gotten a lot better. Now I'm going to go over a few of the things that they gave me to help me while I was recovering from all of this stuff. It's kind of neat stuff that you don't think that it's kind of everyday stuff. But to start with, they gave me a shoehorn, a long shoehorn, which, because of my limitations that I'm not allowed to, for 3 months, I'm not allowed to cross my legs. I'm not allowed to bend past 90 degrees at my hip. I'm not allowed to cross my legs, do that kind of thing. So this helps me be able to get my shoe on. I still need Judy's help to tie my shoes and that type of thing, but it helps me get myself to the point where, and it's an awful lot of fun playing with the dog with it too. But that's my shoehorn. They gave me this little contraption that somebody put together. It looks like a regular wall hook that's put onto a rod, and that helps me be able to get my push my socks off and be able to hook onto something to grab something if I needed it. And that's helped out a little bit. And they gave me this little gripper so that I can reach things without having to bend over, and that also helps get things lined up to be able to get dressed and that type of thing. And it also drives the dog nuts. Little contraption is amazing and has helped unbelievably. This is what I use to put my socks on. You pull the sock over the top of it. You have a couple of handles. You set the thing down on the floor, put your foot into it, pull the ropes, and it pulls up and puts your sock on for you. And if you've ever tried to put compression socks on, They don't go on very easily. They're quite a chore to put on, and this thing makes them so much easy. They also gave me a sponge on a stick for taking showers. I couldn't take a shower for the first, wasn't able to take a shower for the first 5 to 7 days because of the wound patch that was on me, and they had put a wound vac and hooked that up to it. During those first, we left the patch on for about 7 days for a full week. So during that first week, in order to clean up, we used some stuff that we used for while we were dry camping or boondocking,
And my mom.
and also used for Judy's mom for cleaning up and that type of thing. They're called scrubs, and they're a rinse-free bath sponge. They look like a pad like that. You just add water to it, and you're able to use it to wash up, clean up, and they work amazingly well. Also, we have some of this Nurture Cleaning Made Simple stuff. That also, it's a body cleanser so that you can go ahead and wipe yourself down with the stuff and get yourself clean, keep yourself clean during that time when you weren't able to take a shower.
It's good for hair too.
You can also use it on your hair, and it's for a full body type of thing, so that all works really good. Some of the other equipment that the VA gave me to recover with, they gave me a walker to get in and out of bed and around to start with for the first few days. I also got a rollator, so that it's a rolling walker.
That was before you even.
Yeah, I got that before, just so that I could exercise my hip and try to get the muscles built up before surgery. And they gave me a cane that I also got before surgery to get used to using. And I went from the walker that I used in the house all the time to now that I'm using the cane, or just walking around without the cane at some points. And when we go out for our walks to try to do some exercises every day, that you probably will see in the video, started out with a half mile up to a 3/4 of a mile now, using the rollator on a flat surface. And everything has been working really well, and I'm very happy so far with the way things are going. I'm frustrated, yes, because I want to be more active, I want to be able to do more, but I understand that it's going to take a little bit of time. For anybody who has an upcoming hip replacement surgery, or that type of joint replacement surgery coming up, and they have any types of questions, don't hesitate to reach out and ask questions. I'll do everything in my power to answer your questions for you. Okay, if you like this video, give us a thumbs up. Hit that subscribe button, leave some comments down below. And we want to thank everybody for coming along on our journey so far.
We look forward to the coming year.